Ever wondered what monkeypox is? Well, don't worry, you're about to find out. Monkeypox is a zoonotic illness. That means it's a disease that can be transmitted from animals to humans. It's caused by the monkeypox virus, which is an orthopox virus. This puts it in the same family as the variola, vaccinia, and cowpox viruses. The first human case of monkeypox was detected in the Democratic Republic of the Congo in 1970. Since then, the disease has caused sporadic infections and outbreaks, mainly in some countries in West and Central Africa. However, in July of 2022, the World Health Organization declared monkeypox a public health emergency of international concern. This was due to an unprecedented global spread of the disease outside the previously endemic countries in Africa. The 2022 outbreak of monkeypox was primarily associated with close, intimate contact, including sexual activity. Most of the cases were diagnosed among men who have sex with men. These cases often presented with novel, epidemiological and clinical characteristics. So, what does monkeypox look like? Well, after an incubation period that ranges from 7 to 10 days, most patients present with a systemic illness. This includes a fever, muscle pain, and a characteristic rash. The rash starts as papules, which then evolve to vesicles, pustules, and crusts. These can appear in the genital, anal, or oral regions and often involve the mucosa. Complications requiring medical treatment occur in up to 40% of patients. These include rectal pain, difficulty swallowing, swelling of the penis, and skin and anorectal abscesses. Most patients have a self-limited illness. Between 1% and 13% require hospital admission for treatment or isolation. The good news is, the case fatality rate is less than 0.1%. A diagnosis can be made through the presence of orthopox virus DNA in PCRs from lesion swabs or body fluids. Patients with severe manifestations and people at risk of severe disease, such as those who are immunosuppressed, could benefit from antiviral treatment with tecovirimat. The current strategy for post-exposure prophylaxis or pre-exposure prophylaxis for people at high risk is vaccination with the non-replicating modified vaccinia ankara. However, antiviral treatment and vaccines are not yet available in endemic countries in Africa. To summarize, monkeypox is a zoonotic illness. It presents with a systemic illness, including a fever, muscle pain, and a characteristic rash. It is primarily spread through close, intimate contact. The disease can be diagnosed through PCR tests, and there are treatments available, although these are not yet accessible in endemic countries in Africa. Although serious complications can occur, the case fatality rate is low. So there you have it, a brief overview of monkeypox. Knowledge is power, and understanding diseases like this can help us to prevent their spread and effectively treat those affected.